awkwardly writing about myself because I asked one of my preceptor to write me a recommendation letter, and she said that I need to write down some characteristics for her. I hate talking about myself and hyping myself up, so this is a very awkward situation for me. But you know, I'm gonna be in the process of applying to residency soon, so this is something that I have to do and be good at. So I'm just gonna finish writing this up. I need to send it to her by tomorrow. This building gives me PTSD. It was where I took my step 1. It's actually really pretty inside. I'm done with my neurology rotation, and I thought I would give you a quick recap of what neurology is like and how my experience was, and just finish off the vlog. So my rotation was a 30-minute drive, and the schedule was 7 a.m. to 3 p.m. every day, and we get Fridays and the weekend off.
So it was very nice. I would say most days I did not get out at 3. That's when we stopped seeing patients, but you know, it can run over and we had to write notes. At the end of the day, I only did outpatient neuro, so my whole month I did clinic days versus some rotations will give you a mixture of inpatient as well. So you get to go into the hospital and see how neurology works there. So I'm sad I didn't get that experience, but I really like the variety in neurology. You get to see a lot of different pathologies and you see a ton of different types of people, you know, from young adults all the way to older adults. You see a ton of different diseases. The bread and butter of neurology is gonna be migraines and headaches, tremors, dementia, sadly, multiple sclerosis, Parkinson, strokes as well. So that's why I really like the variety. Second, there's a lot of procedures that neurology gets to do. We get to do a lot of botox injection for migraines and spasticity. So people who have like chronic migraines cannot get rid of it with regular medications. You can try botox. And also people who have strokes, they have hyperspasticity in their extremities. Botox can also help like relieve the tone of that muscle. And then you also get to do a lot of EMGs. EMGs are the electromyographies. It tells you if you have neuropathy or not. Basically, you get a needle and you stick it in different muscles of your body and you see if that muscle is firing properly. If it is, then you know the nerve that's associated with that muscle is good. So you can diagnose people with carpal tunnel or neuropathy from EMGs. You can also do EEGs, which is where we hook up a bunch of electrodes to people's brain, and then we kind of watch their brain activity and see if there's any concerning brain waves. I also think it's cool that there's a lot of different specialties you can do in neurology. There's a ton. There's neuromuscular disorders, there's interventional neurology where you get to do procedures for stroke, and then there's neuropsych where you get to focus more on people with dementia and Alzheimer's, all of that. So some of the things that a lot of people might not like about neurology is the tons and tons of history that you have to get from a patient. Neurologist works a lot from context clues, like with the physical exam, like how well can you do a thorough neurological exam, as well as getting as much history as you can from the patient. So that can be a lot for some patients. But besides that, I really enjoyed my time there. There are some misconceptions about neurology that I want to address. But a lot of people think that, you know, if you have a neurological disease, you're basically screwed and that's all there is. You can't live a normal, happy life, but you really can. Neurology is a very growing field, and so they're coming out with a bunch of different medications and ways to kind of treat these diseases that we didn't have any treatments for in the past. So all the patients that I saw, they were all managed. You know, they just come for their 6-month appointment and they seem like they are able to have great quality of life. Yes, it is sad to see, you know, some of the more devastating stories of, you know, stroke patients that are in comas, or Alzheimer's patients that are deteriorating, but that's not all you see. And so I personally really liked treating migraines. I thought it was very fun, and it's something that gave so much relief for somebody, you know, like imagine someone with having chronic migraines and having to deal with that every single day, then all of a sudden, like now they don't have to deal with that anymore. So that was my favorite thing to treat. But yes, if you guys have any questions about neurology or how the rotation entails, go ahead and leave comments below and I will answer them to the best of my abilities. I know that the schedules and the types of patients that you see for inpatient is a lot different than outpatient neuro. So hopefully I get a chance to do inpatient neuro in the future so I can see how that is. But I highly suggest you doing a neuro rotation and seeing how you like it. Thank you for watching the vlog and I hope to see you guys on my next rotation.